Hello, everyone. Let us discuss the concept of herd immunity in viral infections, particularly, and let us discuss it in the context of the present pandemic, that is COVID-19. What is herd immunity? Herd immunity means it is a phenomena when a large proportion of the population develops immunity against the virus. That is by producing antibodies. That is the one aspect. Other aspect is the priming of the T cells and memory cells, which can come into play even after the antibody levels comes down, which does after some time. And when a large proportion, say 60, 70, 80% of the population, they develop antibodies or the memory and T cells are programmed against fighting the virus, that we can say we have reached a level of herd immunity when that virus ceases to be a public health problem. It becomes endemic without overwhelming the health services. So this herd immunity can be achieved in two ways. One is when large number of people have experienced the infection, the virus has run through them and they have recovered. And the other way is by vaccination, which are produced in the lab. So this vaccination is a process. The purpose, we can combine the natural people who have recovered from natural infection, people who are vaccinated, together we can reach a level of herd immunity. But actually, in practice, what happens in the COVID-19, we have seen, and we have got data from many countries, that countries which kept the population segregated, that is Taiwan, for instance, and initially in India also, states like Kerala did very well. They totally dependent on the vaccine-induced immunity, perhaps. And now we see the data where the vaccination coverage is very high. The cases and deaths did not come down as expected. Whereas in highly dense countries like India, Pakistan, Bangladesh, most other countries, which are highly dense, and in spite of restrictive measures or lockdowns, we could not control the natural infections. After the second wave, before the mass vaccination rollout, we found almost 67 to 70% of our population in somewhere in June, July last year, they already developed antibodies from natural infection. And subsequently in September last year, we found in Delhi surveys, more than 80% of people below 18 years, that is when vaccination for them was not started, they are already experiencing a natural infection by showing levels of IgG antibodies. So that shows the natural infection in dense countries, they acquired natural infection runs faster than vaccine-induced immunity, natural infection. And the studies from Israel have established that the natural immunity means immunity from natural infection. Recovery from natural infection gives 13 to 26 times more strong immunity compared to vaccine-induced immunity. And therefore, a person who has recovered from natural immunity is almost having 11 to 24 boosters. If you say first dose, second dose, and then subsequent boosters, if it is 13 times stronger than vaccine, because most countries, highly vaccinated countries, are going for second boosters, third, fourth boosters, whereas countries which have already experienced natural are already having a stronger population level immunity. So the concept of herd immunity may differ in highly dense countries compared to countries which are less dense, where the virus does not, and with restrictive measures, the virus has not run through the community, eliciting naturally induced immunity. And the vaccine, if we see the graphs from large number of countries, we find that highly vaccinated countries are also having the surge post-vaccination. So as far as India is concerned, we are having a very less number of serious cases and hospitalization. Though, and even compared to other highly vaccinated countries or Western countries, still considering our population, even the case numbers are not very high. And in any case, the case numbers do not matter, because even with an immune person may experience the infection but not suffer from hospitalization or may not have serious outcomes like death. So that way, I think as far as our country is concerned, even if there are mutations, the natural immunity or the herd immunity can take care of that. It cannot lead to large number of hospitalization and deaths. So we have reached the endemic level.